So Sarah, let's talk a little bit about what we've seen recently in the overlap between addiction, eating disorders, and the commonality, between the two of them, which is trauma.
Absolutely. I know that we've discussed it before. And I mean, substance use disorder and eating disorder really kind of overlap in a lot of characteristics and ways that they can recover.
One of the things that I think is really interesting is there are a lot of addiction facilities that won't take eating disorders, eating disorder facilities that won't take addiction. And I understand that because there are separate medical issues that go on with each condition,
Absolutely.
Right? But if we look at the underlying process, somebody who has an addiction and somebody who has an eating disorder, they have very similar thinking.
Yeah, absolutely.
Right? So tell me in your experience what you've seen in terms of the thinking process, that mindset piece of someone with an addiction and somebody who's in the throes of an eating disorder.
A lot of times with the clients that we work with eating disorder, I'll see that, they get the excitement, they get energy in relation to binging and purging or skimping on their meal plan. And it gives them that high, much like people that are in substance use disorder and have to take their drug to have that energy. When they're not doing those behaviors, they can a lot of times feel a little bit less energized, depressed, unmotivated to do anything. There really is kind of that reward system in their head of, I need to do this. The thinking is the same. I have to do this. I have to do this. I have to do this to make myself feel better. I need to do this.